Okay guys, today we can discuss another case note. This is for Jim Middleton. As usual, we can see the writing task. It says that using the information in the case note, write a letter to the Director, Department of Veteran Affairs, GPO Box 777, Brisbane 4001. In your letter, explain why you are writing and the assistance they are seeking. So in your answer, expand the relevant nouns into complete sentences. Do not use noun form. Use a letter format. So the body of the letter should be approximately 180 to 200 words. So here we are writing this letter to the Director, Department of Veteran Affairs. Here we need to explain why we are writing and what assistance we are looking for. So let's go to the top of the case note. See here, it says that read the case note below and complete the writing task which follows. Notes. Today's date 9/7/2008. So it should be the letter date. Now we can see the patient's details. It says that Jim Middleton, aged 84, was admitted to a ward following surgery for a left inguinal hernia. His doctor has advised he can be discharged within 48 hours if there are no complications following the surgery. Jim reports some pain or movement, but he is keen to return home. So now Jim is getting ready to go home. That is the situation now. Let's see the below. We can see the patient's name as Jim Middleton. His date of birth 3rd July 1924. He was admitted on 7th July 2008. His discharge is planned on 9th July 2008. Diagnosis. We have already seen that it is left inguinal hernia. His medical history says that hypertension, which was diagnosed on 1998. So he is on medication to manage his hypertension. Let's see down. You can see the family history here. Family history. It says that married 50 years ago to wife Olga. So his wife is Olga. And her date of birth is 8/2/32. The son, one son living in USA. Jim is a Second World War veteran who served 2 years in Brno, prisoner of war, 16 months. So he served 2 years in Brno and prisoner of war, 16 months. See, he has his own home with large garden, which they maintained without any assistance. Moreover, they are very independent and proud that they have never applied for a pension for home assistance because they've always managed this home and garden quite well with their own income from a number of investments. So they've never applied for a pension or home assistance so far. Now, Olga says that she is worried because income from this investment have recently been significantly reduced due to the severe stock market falls. So, due to the stock market crash, the income from the investments have been reduced. So, Olga is really worried. So, she is concerned Jim will not be able to continue maintain the garden and they will not be able to afford a gardener or any other help at this time. So, Olga says that Jim will not be able to maintain the garden, and also he will not be able to afford a gardener at this time because they have financial difficulties. Moreover, it says that transport is also a problem for Olga because she does not drive. Moreover, she is not close to any reliable transport. So in case if the department asks Olga to reach there to the office, Olga will not be able to travel because transport is really a problem. Moreover, she does not know driving. Moreover, she is not close to any reliable public transport. She is not able to travel at the moment. So she has some problem with her transport facility, so she needs to rely on taxis. So Olga thinks that they may now be eligible to receive a pension and other assistance from the Department of Veteran Affairs, but doesn't know how to find out. Moreover, she doesn't want to worry Jim, her husband. So now Olga wants to understand that if they are eligible to receive a pension and any other assistance from the Department of Veteran Affairs. So this is the purpose of the letter. So I hope you're clear now. Yeah. Now we'll see down. Olga is in good health, but becoming increasingly deaf. Finds phone conversations difficult. She would appreciate a home visit. You agree to inquire on behalf. Their address is given below. So it says that Olga is not able to hear properly. So phone conversation would also be difficult. So if anybody calls from Veteran Affairs Department, that would be a little difficult. So she wants somebody from the Veteran Affairs to visit them at home and explain more about their eligibility. So they have given the address here. Now let's see the discharge plan. Must avoid any heavy lifting. Should not drive for at least 6 weeks. Light exercise only. May take 2 Panadol, 6 hourly for pain. Appointment made to see surgeon for post-operation check at 10 a.m. on 11th August. Do you think we need to explain this discharge plan on OET letter? No. Why? We are writing this letter to the Veteran Affairs Department, right? Do you think they'll be able to check all this plan? Do you think they'll be able to monitor all this plan? It says that Jim Middleton should avoid any heavy lifting. Do you think Veteran Affairs can monitor this? No, as it's at some other place, right? In an office. Jim will be at his home. Here, the Veteran Affairs Department's duty is to visit Mr. Jim at his home and assess his eligibility to receive pension and other assistance. Moreover, it says that he should not drive at least for 6 weeks. So, Veteran Affairs cannot do anything on it. So, it's really not relevant for them. Light exercise only. Obviously, Veteran Affairs cannot look into it. Moreover, it says more about medication, and also it says that about the appointment made with surgeon. So, this information are really irrelevant for the reader, the Veteran Affairs Department. It says that contact Department of Veteran Affairs to review eligibility for pension and home help. We have already seen this, right? So, here the reader, the Department of Veteran Affairs should visit Mr. Jim at his home and assess his eligibility to receive a pension or home help. Based on this case note, let's see how we can write a sample letter.